Okay, I've washed my hands for infection control. Hello, my name is Veronica. I'm an RN. I'm going to be doing your head-to-toe assessment. It's going to take me about 25 minutes or less. And I'm going to pull the curtain for your privacy. Can you tell me your name?
Justin Allen. Just call me Justin.
Okay. Hello, Justin. Nice to meet you. Can you tell me where you're at today?
Medical clinic,
And what's the day?
October 1st.
Okay, LOC is intact. I'm just going to feel around on your head and just explain. Just let me know if anything feels tender or if anything hurts, okay?
Okay.
Head is normocephalic, atraumatic. There's a scar noted on the top frontal lobe. The hair is evenly dispersed. Skin is continuous throughout. There's facial hair on the chin and the sides of the submandibular sides of the face. I'm just going to press here. Any tenderness?
No.
No tenderness. And the frontal and maxillary sinuses. Alright, can you close your eyes for me and just let me know, or tell me the word now whenever you feel me touch?
No. 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 No.
Okay. Can you open your eyes and smile for me? And raise your eyebrows? Okay. Cranial nerve 5, the trochlear, and cranial nerve 7, facial, is intact by evidence of equal symmetry of the smile in the face. The eyebrows are evenly distributed on both sides. They're symmetrical. There's no scaling noted. The eyelashes are equal on each side, distributed on the upper and lower lids. There's some small scaling on the eyelids. Can I have my pen up, please? Just going to inspect your pupils for the right here at my nose, please. Look right here. Follow it in. Okay. The sclera is a little bit pink. Conjunctiva is pink also. The eyes are pearla. And also you would assess the cranial nerve 2, the optic nerve, by using the Snellen chart. You would have the patient stand 20 feet from the sign, cover one eye, read as far down as they can get, cover the other eye, and then assess both eyes to figure out if the cranial nerve to the optic is intact. Can you close one of your nostrils for me and inhale, please? And do the same on the other side. Okay, and look up for me. Okay, the right nair is a little congested. The left nair is patent. The septum is midline. The septum is a little bit deviated to the left. Also, you would assess the optic nerve 1, olfactory, by a sense of smell. Look at something that the patient is familiar and can close their eyes and smell. In this case, I don't have anything with me, but that's how you would assess that. Also, we're going to assess the cranial nerve 3, the trochlear, and the cranial nerve 4. Cranial nerve 4, trochlear, and the cranial nerve 3, trigeminal, by the 6-point gaze. So if you can just follow my finger for me, please. There's equal movement of both eyes, no nystagmus noted. Elastic recoil quickly on both ears. Any tenderness?
No.
No tenderness in the pinea or tragus. You touch your head. Okay. There is no serum present. You would also assess the optic nerve, you would also use the otoscope to look at the tympanic membrane to check for the clearancy, if there was any redness for it being intact. You would also note some more cerumen if it was present. I'm going to assess the cranial nerve 8 acoustic by whispering a 2-syllable word, and I will let you know what that is in just a moment. Okay, so I'm going to say a word and whisper it. You look straight ahead and just let me know what the word is.
Baby.
Okay, I'm going to come around to the other side and repeat the same word, and you just let me know what it is.
Baby.
Okay, so cranial nerve 8, like I mentioned before, acoustic is intact. Alright, open your mouth for me, please. Say ah. Okay, show me your teeth again. Okay, I do not have a tongue depressor, but if I did, I would also elect the gag reflex. This is testing the cranial nerve 9 glossopharyngeal and also the cranial nerve 10 vagus. In this case, they are intact other than eliciting the gag reflex. The tonsils are 1+ on a 4-point scale. The uvula is midline. The hard palate is white. The soft palate is a little bit pinker. The the gingiva is pink. No inflammation or bleeding noted. The teeth are slightly tinted yellow. There is facial hair, like I said, distributed on the lower jaw. Skin on the face is a little bit worn but dry. Hold this, please. Okay, just let me know if any of this is tender. I'm assessing the lymph nodes at this time. Any of that tender?
No.
There's no lymphnopathy in the lymph nodes on the submandibular, submental, the preauricle, postauricle, the optic, the jugulo-digastric, the superficial clavicle, the deep clavicle, the superior scapula. Okay, can you tilt your head all the way back for me and touch your chin to your chest? Okay, and also try to lean backwards with pushing against my hand. Good. Okay, we're going to do side to side. Try to put this side over here towards your shoulder. Good. And on the other side. Okay, and rotate your neck both ways. Okay, this is testing the cranial nerve 9, spinal accessory, and it is intact as noted by strong trapezius and subcleromastoid muscles. I'm assessing the carotid arteries. I'm going to auscultate them. Hold your breath, please. Okay, you can breathe. Hold your breath again. Carotid arteries are 2+, strong and equal bilaterally. Skin is warm and dry on both sides. There are tattoos noted on both upper and lower arms, biceps included. The hair is evenly distributed. There is some slight scaling on the tops of the hands and the bends of the arms. There is a red rash noted on the bends of the elbows. From patient history, this is related to eczema. Radial pulses 2+, strong, equal bilaterally. brachial pulses strong and equal bilaterally. And also, if I haven't mentioned before, the vitals were taken. The blood pressure was 124/78. Pulse was 90. Temperature was 98.2, and respirations are 22. This is normal for the patient history. Now I'm going to assess the lung fields on the back, posterior. Okay, take a deep breath in. Vestibular breath sounds were noted in the posterior lobes. I did assess 6 places in the back on a zigzag pattern, just in case you couldn't see that. Also, I'm going to assess for tactile fritimus and also percuss in 2 places. Can you say the word 99 for me, please?
99.
Again?
99.
Good. Tactile fritimus was felt with that. Now I'm going to percuss the right lower lung field. And the left. Resonance was heard. Okay, if you go ahead and lean back just a little bit for me. Okay. Chair is locked. Now I'm just going to visualize any pulsations, heaves, or lifts. None are noted. I'm going to palpate the aortic, pulmonic, tricuspid, Erb's point, and mitral. Here would be the aortic. Pulmonic. Erb's point at the 3rd intercostal space. And the mitral, tricuspid, and the mitral. S1 and S2 are noted. No murmurs, rubs, or gallops. I'm going to visualize the abdomen. And now I'm going to auscultate. All 4 quadrants. Vowel sounds are active in all 4 quadrants. Now I'm going to palpate. If you'll just let me know if anything feels uncomfortable or if it hurts. And you make sure and do this with the pads of your fingers in kind of a circular motion as you push down. No tenderness noted, no hepatomegaly. Also, because this is the male, you would assess in the female and of course the male too, the breast exam. So what you want to do is have the patient sit up, and you would have the woman or man raise their hands, and this is going to be checking for any dimpling, retractions. We're also going to put the hands on the hips, and press. This will bring out some dimpling or retractions if there was any, and also putting their palms together and pushing to kind of contract that muscle. You would also note any nipple discharge, the areola color, if anything was abnormal, if one breast was extremely larger than the other, of course. And then to do your actual manual breast exam, you're going to have the patient lay down, trying to keep them covered as much as possible for their privacy. You want to, the breast that you're assessing at the time, you want to have the patient raise their hand all the way up over their head. This will get a more better feel to palpate with. You're going to palpate in a vertical strip motion, but also when you do the vertical in a small circles. And this is going to be looking for any lumps, masses that are non-movable or movable, and also you're going to slightly squeeze the nipple to look for any discharge or retractions also at that point. You also want to make sure, I should have said this a while ago, but back up, when they're sitting up, you want to make sure and assess the axillary lymph nodes. You want to do lateral, center, posterior, and anterior to check for any of the lymphadenopathy. Sorry, I cannot express that word correctly. Now we're going to be assessing the lower extremities. The skin is warm and dry, hair is evenly distributed. No swelling or edema noted. There is a small red rash type area on the left calf. Both pedal pulses are 2+, equal and strong bilaterally. Cap refills on the toenails are less than 2 seconds. I just need to see your fingernails. Cap refill on the hands are less than 2 seconds. Turgor is less than 3 seconds.